Hi, my name is Hilma Volk and I've been a massage therapist since 1991, and I'm going to talk about the real reason you get carpal tunnel, and sometimes you think you have carpal tunnel syndrome, but you may actually not have it at all. The reason you have carpal tunnel syndrome is muscle imbalance. Now what do I mean by that? Okay, for every muscle that you have, there's an opposite muscle. I mean, I'm talking about skeletal muscles, not like heart muscles. But anyway, the most common muscle you know of muscles that do the opposite things are triceps and biceps. Biceps do this, triceps do that. Well, every other muscle has an opposite muscle. Muscles that do things and muscles do the opposite action. And in your hands, most of the movement that is done by your hands is actually done by the forearm muscles. And the muscles that close your fingers are the flexor muscles. They're called flexor muscles. Even any doctor will tell you there's flexor muscles because they have names like flexor this or flexor that. And the muscles on the back of the forearm are the ones that open your hands, and they're called extensor muscles. Now, the flexor muscles make your hands close, make your fingers close, bring your wrist down. The extensor muscles do the opposite. Now, when you're typing or playing a musical instrument or squeezing things or gripping things or lifting weights with grips, what muscles are you using? You're using the flexor muscles. When you open your hands, there's no resistance. When you close your hands against something, or when you're typing or playing a guitar or piano or whatever, these muscles are pushing. So these muscles get stronger, relatively speaking, compared to the extensor muscles, which don't have any resistance to go again. And usually you're not stretching your hands out. Usually you're just working your hands down. Now, these muscles get tighter the more they are used. When a muscle gets tighter, it shortens. Why does it shorten? Well, you get knots. Knots are muscle fibers stuck together, and you get shortening in the muscles by muscles in contraction. Little cells within the muscle get stuck in contraction. Not the whole muscle, but parts of the muscle, little cells in the muscle. And the less your muscles get stretched out, the less they can get stretched out. And these tendons, which are attached to the muscle, because tendons attach muscles to bone, and the tendons that come from the forearm go through the carpal tunnel. And you can tell that your forearm muscles move your wrists and fingers just by gripping your forearm and feeling what happens when you move your hand around, when you move your hand up and down. And you see these tendons move up and down. They look like little pencils there. But anyway, because these are thicker and shorter, they pull your wrist forward. When your wrist is pulled forward, there's less room in the carpal tunnel area. When there's less room in the carpal tunnel area, there's more pinching on the median nerve, which makes your hands numb. Now, a lot of doctors will recommend wrist splints at night so you can sleep. And what does a wrist splint do? It holds your hand in a neutral position. And when it's in a neutral position, your carpal tunnel is open. And that's why you can sleep. So doctors already know that keeping the carpal tunnel open makes you feel better. It gets rid of the numbness. But it's not curing anything. It's not actually reversing your problem at all, because you keep on typing and doing whatever you are doing, and you think you're getting better because you can sleep at night, when actually the problem is just accumulating. It's just that this at night keeps your carpal tunnel open. Now, try an experiment with me. I want you to hold your hand in a neutral position. The neutral position is when the back of your hand and the back of the forearm are in a straight line. Now just put your hands down with your hands facing your side. with your hands in a neutral position, and then forget about your hands. Don't pay any attention to them. You see, if there were no muscle imbalance in your hand and forearm would stay in a straight line. The back of your hand and forearm would stay like that. But if they curl in, that's muscle imbalance. And what you need to do about that is correct the muscle imbalance. And how do you do that? Well, a lot of programs use stretching, but the fact is that stretching is a very slow process. Why? Because when you stretch a muscle, the parts of the muscle that aren't stuck together, that are not shortened, are the ones that are easiest to stretch. The parts of the muscle that are stuck, either with muscle fibers stuck together or with scar tissue in them, or muscle cells stuck in contraction, those are the last things that want to stretch. So by the time you're done stretching, those probably haven't even been stretched yet. Or if they are, just a minimal amount. So it takes more and more time to get to those muscles to loosen them up by stretching. Whereas if you have self-massage, and I show you self-massage techniques in my course where you are not using your hands, because I know they're already weak from your problem. So you're not using your hands to actually do a self-massage on yourself. And this is much, much better than having a massage therapist do it. Now, I'm a massage therapist. I've been a massage therapist for 20 years, and I know there's not a lot of great massage therapists out there relative to the number of massage therapists who aren't that effective in solving problems. Most of them are just what I call the slide and glide. They feel good. They may help your back out and stuff, but very few have studied how to treat carpal tunnel syndrome. And even if they have, all you need to do is work on it a few minutes, 5 minutes at a time, a couple times a day. Now, you wouldn't go to a massage therapist for that. You'd waste a whole lot of time, waste a whole lot of money. You don't need to do that. You can do it yourself. And as far as the programs that only talk about carpal tunnel and what it is, well, there's other things that cause the problems in your wrists and fingers that are coming from other parts of your body, such as the front of your neck. And anyway, I show you how to find those and what to do about them and how you locate those. And again, it's something you can do yourself really, really easily. It's not hard, and it doesn't take all that long to do. How long does it take? Well, it depends on how bad your situation is. I mean, if you're just doing a minimal amount with your hands and it's not a bad problem, you can get rid of that problem really quick. If your problem's been around for a while and it's not severe enough that you need carpal tunnel surgery, that your hand's not totally dead all the time, where you're not in danger of total nerve damage, you can reverse that, and you'll feel yourself functioning better all the time, but it's better to keep at that. And if you are in an occupation where you're using your hands a lot, you want to do maintenance on them once you've got it cleared up, because you're still doing the things that cause the problem. Hopefully you will learn ergonomic techniques either through me or through other sources that I give on how to, keep your hands so they are causing you less damage, but you still want to be able to function with your hands to do your job or to play your instrument or whatever it is that you do, your hobby of knitting or gardening or whatever. So, but the thing is, if you don't take action, your problem will get worse. And if your hands are getting numb or tingly now, think what they're going to be if you keep doing what you're doing the way you're doing it. Think about what happens 10 years from now, or 5 years from now, even a couple years from now. And if you've already had carpal tunnel surgery and it's come back, it's because you keep on doing the things you've done before, or you've got scar tissue from the surgery. But you can reverse yourself again if it's caused by the muscle imbalances. If it's caused by a screw up in the surgery, well, I don't know what you can do about the screw-up part. So there you are. Take a look at my page, sign up, and get yourself better, okay?